Why is airflow limitation central to COPD diagnosis? Imagine trying to breathe through a straw that keeps getting narrower. That's what airflow limitation feels like for someone with chronic obstructive pulmonary disease. It's the main sign doctors look for when diagnosing this condition. When your lungs are healthy, air moves freely in and out, delivering oxygen and removing carbon dioxide smoothly. But in COPD, something changes. The airways become inflamed and damaged, and the lung tissue loses its elasticity. This causes the air to have a hard time flowing, especially when you breathe out. Doctors use a test called spirometry to measure this airflow. It's simple but powerful. You breathe into a device that measures how much air you can exhale and how fast you can do it. The key measurement is the ratio of the amount of air you can force out in 1 second to your total lung capacity. If this ratio drops below a certain level, it shows that airflow is limited. Specifically, a ratio less than 0.7 after using medication confirms airflow obstruction, which is a hallmark of COPD. This airflow limitation is not just a sign. It also tells us how severe the disease is and how it might progress. Early on, small airways start to narrow, but the limits on airflow might not be obvious yet. As the disease advances, more damage occurs, and airflow becomes more restricted. That's why catching airflow limitation early can help with managing symptoms and slowing progression. Symptoms like cough, mucus, and shortness of breath are common in COPD, but they can be caused by other lung problems too. Spirometry gives an objective way to tell if airflow is truly limited, making it a vital part of diagnosis. It helps doctors distinguish COPD from other conditions and decide on the best treatment. In short, airflow limitation is central because it directly shows the core problem in COPD, the difficulty in moving air in and out of the lungs. Without measuring this, diagnosing COPD would be much less accurate. It's the key that unlocks understanding of the disease, guiding treatment, and helping patients breathe easier.